Brain mapping is a very cutting-edge technology that we can use to actually look at our patient's brain. And that way we can show the doctors what is going on inside the brain, if there is overactivity or underactivity. And then we can use neurofeedback therapy to help regulate it.
I see brain mapping as one of those tools that can look deeper at what's really going on in your brain, how those connections are firing, what are the areas that need more help and what not. And then, very personalized, go ahead and treat that patient very differently than maybe some other patient with similar symptoms, because every brain is very different.
So what neurofeedback does, it actually helps retrain new pathways in the brain and healthy pathways that improve the symptoms of our patients.
It's not anything I can say, you know, my brain felt different. I just felt different.
I think before I do things, it's a lot easier.
It's very exciting to see, your brain on a computer right next to you and how you can fix it.
It explained more. I kind of saw more of what was going on in his head and why his thoughts seemed to be all over the place.
With ADHD patients, most of the time their brain is overactivated. It's running too fast, and it's not allowing the brain to process information efficiently.
So, for instance, with a patient that has ADD or ADHD, we see a pattern. We see a certain wave called a theta wave, and there are other waves called beta waves. So the patient that has ADD or ADHD has a high theta to beta wave ratio. So it's a very classic picture that we see. And what we're able to do is actually retrain the brain so that we can retrain down the theta waves and uptrain the beta waves. And in doing that, that actually helps our patients with their symptoms. It's safe, it's effective, and we're not worried about side effects to prescription drugs.
A lot of patients will say, are you a mind reader? And I laugh, we're brain readers. So it's something that is very efficient for the doctors to be able to confirm what the patient is telling them, or it helps them really nail down exactly what is going on and what is causing those symptoms.
Patients feel like a very refreshed. It's like finally somebody is listening to me, understands, I'm not crazy, this is something real that is happening to me, and finally somebody's gonna invest the time to figure it out.
It's all individualized, unique to you, whether the type of the part of the head that you put the nodes on to the type of waves that help you overcome, the stress, the anxiety, the anger. It's all tailored to you specifically.
When I saw my brain in the 3D form on the TV, it was pretty cool.
Danielle showed me on the map the different colors, and there was a lot of red, and it was that which meant pretty much where just all kinds of things were going off. To me, his brain is just firing all the time. And I think that's what causes the ADHD. There's so many things going on, and that's why he can't focus on just one thing.
I felt like just because I don't know how it works doesn't mean that it won't work for me. So I was willing to try it, and I'd rather do that than to be popping pills all day long.
Neurofeedback is outstanding. It's amazing for so many different symptoms, such as anxiety, depression, chronic migraine and chronic pain, ADD, ADHD, and cognitive decline.
Not every child that has been labeled with ADD or ADHD truly has that condition. Sometimes they have other conditions that are underlying that haven't been discovered.
I think that it has changed his life. I've asked him, does he notice things? And he has told me at school, he can tell, he's more focused, he's paying more attention.
On my report cards, I'd always have this excessive talking thing. Now I don't really get that anymore on my report cards, so that's made me happy.
Now, I guess my brain's putting out the right type of waves because I'm not angry anymore. I can help, I'm much more relaxed, I can focus better now. So with that training, it really has helped me.
Whatever the day gives me, I can handle it. So for me, it's a big step.
It's your own brain doing its work, you're just guiding it.
It's very liberating for the patients to finally understand what's going on inside their brain. I can't tell you how many times I've had patients tell me, you're an answer to prayer. I am not crazy. This is amazing that you are telling me what I've always felt, but I could never explain.
It's been slow, but steady, and it's been a welcome relief.